I'm going to teach you about kidney disease. Um, with kidney disease, the kidneys are not able to filter out waste and excess fluid and electrolytes like it should be. Um, and when the waste builds up, you run the risk of getting uh, an infection. Um, Also, if your electrolytes build up, such as like potassium, you run the risk of having heart problems because it causes potassium can cause irregular rhythms. You also at risk for excessive phosphorus, and when you have too much phosphorus in your blood, you can end up with um, bone damage, and you can end up losing muscle mass because the phosphorus causes the calcium to leave your bones, and it ends up in your bloodstream. Um, let's see.
This should hold you till morning.
The risk factors for kidney disease, two of them are diabetes and high blood pressure. And they can cause kidney disease. Some symptoms of kidney disease are tiredness, feeling weak. You can have abdominal pain or feel like you're going to throw up. You can have muscle cramps. You can have you can become confused, and you can have a decreased urine output. Some treatments include usually what they try to put patients on are like calcium supplements to help build back up your bones and to get your calcium level back up to normal as well. And also, they usually put you on like a phosphorus binder. And what that does, it causes the excess phosphorus in your blood to attach to those binders, and that way your excess phosphorus comes out in your stool.
Saying that you've learned?
One thing to kind of do that can kind of help reduce the kidney damage is to cut back on your protein intake and eat things that are like fish or chicken, because they have less protein. Because when you eat dark meats like beef, then those have a lot of protein in them, and that protein can end up building up in your bloodstream, and that can cause kidney problems.
You're still playing.
Also, you want to reduce your salt intake, because when you eat a lot of salt, it causes you to hold on to a lot of fluid, and when that happens, you end up when you eat a lot of salt, you end up your body holds on to that fluid, and it causes a lot of swelling. Another treatment would be
An even split?
dialysis, which is when you go to a facility and they basically put you on a machine, and a dialysis machine, and it basically pulls out the excess fluid and the waste and the excess electrolytes.
That's easy.
Some other things you want to do to kind of help would be also to take your medicines as ordered by your physician. The National Kidney Foundation says that there are like 37 million Americans that may have chronic kidney disease, and about 800,000 people that have end-stage kidney disease. Another way that they take care of patients who have kidney disease is you can get on the transplant list, which is when you can get an organ transplant, you can get a kidney transplant, and that would help with any kidney. That will replace your kidney so that you would have a functioning kidney to pull out that excess fluid and waste. And that's it. I'm trying to think what else am I forgetting.
Well, thanks, Mrs. What happened?
You got yourself dry gulched is what happened.
Symptoms, treatments, prognosis.
I sure never figured Curly to
If
do
you
a trick
follow
like
the
that.
doctor's orders, then your prognosis is not bad. But dialysis was never meant to be a permanent fix for renal failure. Eventually, you would need a kidney. Sometimes you can reverse it.
I sure appreciate that, Festus.
Depending on how much damage there is.
No, it went clean through. Who was this fella? Well, I went up yonder and took a look at him. Wasn't nobody that I'd ever saw before in all my